Hi, I'm Dr. Shruthi Chikkaiah, consultant dermatologist and dermatosurgeon from Bangalore. Today we'll be talking about surgical options for the treatment of vitiligo. Now, vitiligo, as we all know, is a chronic autoimmune disorder where there's a progressive loss of melanin from the skin and it manifests as white patches occurring all over the body. It can affect any part, right from the scalp till the toes, and it behaves very differently in different patients. Although there is growing awareness about vitiligo among people, among the general population, we still see a lot of patients coming in late for the treatment of vitiligo when it has already spread all over the body, believing that there is no treatment available or it is not a curable problem at all. People are partly right. We do not have a cure for vitiligo, but it can be well controlled and it can be treated. Now, why it is important to take treatment for vitiligo? Because although it's not life-threatening, it can significantly impact a person's quality of life by reducing their self-esteem, and no matter what, it still has a social stigma in our society. So that is why, to improve the quality of life, a person should definitely take treatment for vitiligo. Now, many treatment options are available for vitiligo. Treatment is first aimed at reducing the spread of the patches and then getting the color back in those patches. Now, various treatment options are available ranging from topical creams, corticosteroid creams, non-steroidal creams, phototherapy. We take phototherapy for inducing color in those patches, and also systemic immunosuppressants to control the spread of patches. Now, despite many treatment options available for vitiligo, we have seen some patients either poorly respond to the treatment, or they respond very well, or there are some islands of patches because of unknown reason. So they don't respond to the treatment, and there are some patches that do not repigment at all, as in the color does not come back in those patches. There are certain high-risk areas where on the bony prominences or where there is less hair. So these patches do not repigment at all, though they are on good treatment from their respective doctors. This is where the surgical treatment options for vitiligo come into play, where the resistant patches can be completely treated, where the color can be completely included in the patch, where your medical line of management is not able to handle. So in recent years, a lot of surgical treatment options are available for patients for a cosmetically acceptable color match and a faster repigmentation of the patches. Now the next question arises, can all patients go for a vitiligo surgery? Yes, but you have to fulfill certain criteria. If you're ticking those boxes, yes, you can go for the surgery of vitiligo. The first and most important being the stability of your disease. Now, stability of vitiligo is a very important factor to decide whether you are a candidate for surgery or not. Now, what is the stability? People might have had white patches for a very long time, but stability of a disease means when you have not had any new patches or the spread of existing patches has stopped for almost a year time, that is when you are safe to go in for a procedure. So many times you get patients asking for an immediate remedy for the treatment of these patches. Doctor, can you correct this patch with a surgery because my daughter or my son is having a wedding coming up in next 2 months, 3 months. Can this be fixed immediately? No, this won't be possible. So a patient should be aware how long it would take for a procedure to repigment your patches, and also what is the criteria that you should fulfill for undergoing the procedure. So now, why is it important about the stability part of vitiligo? Because if your patches are not stable for the last 1 year, there is always a risk that the disease might reactivate. Even where we do the surgery or even where we take out the skin from, those patches are also at a risk of getting depigmented. You might lose color in those patches. So it is very important to make sure that your disease is stable. So even after the surgery, the patient may take about 6 months to 1 year of time for the patches to repigment and to achieve a cosmetically acceptable result without having to have uneven patches. So it's important to know how long do you have to wait to get a procedure done and plan your event accordingly. Now the basic concept involved in vitiligo surgery is you take melanin producing cells from a healthy skin and transfer it into an affected site. That is where you don't have color, you transfer to those patches. Now there are so many treatment options, that is the technical types varieties available for the surgical treatment options of vitiligo. You have a range of options depending on where you have patches, the extent of involvement of the patches in a patient, and also there are some special considerations like the hair bearing areas. So depending on these scenarios, your doctor will tell you which is the best treatment type of vitiligo surgery available for you. Earlier, we had very less options for vitiligo surgery. We had only the option of skin grafting, where they used to take a patch of skin and put it on the affected area where it used to look like a patchwork. But now the procedure is more refined to give a cosmetically acceptable or aesthetically pleasing result. So what are the types of vitiligo surgeries that we do on a day-to-day basis? So we have something called the mini punch grafting. So this involves taking bits of skin. We have special plates where we take symmetrical bits of skin from the healthy donor area, and most of the time the donor area involves your upper arm or the upper thigh, where it is a concealed area, and it heals with very minimal scarring, so you don't have to worry about the scarring of the donor area. Now we take bits of skin from this healthy donor area. We make equally those bits of holes in the affected area and transfer those melanocytes into those holes. So this is called a mini punch grafting. Now the next variety is called the suction blister grafting, where this is usually performed for very delicate areas like the lips or the eyelids, where we intentionally raise the blister. Like when we drop a hot water or anything on our skin, we get a blister. So this kind of a blister is intentionally raised by various techniques, and the roof of the blister is taken and transferred to the affected area. This is more of a cosmetic procedure where we require an even color match, especially performed for lips or eyelid areas. Now the next kind is where a large body surface area is involved and you have to cover a lot of melanin with a very limited donor area. We do something called epidermal cell suspension. So this is for larger areas, and even the results are quite good with it. And the next is your hair follicle. We take something like hair transplantation. We take the hair follicle and transfer it to an area, because hair follicles have a lot of reserve melanin and they start to produce color in those affected areas. So this is the beauty of vitiligo surgery, where the melanin from either the skin or the hair, when it is put into a different area, affected area, it starts to spread and the color is achieved. Why many people are opting for these procedures? Because of the ease and simplicity of the procedure, and almost, I would say, no side effects. Now, the simplicity of the procedure, because it is done almost under local anesthesia, there is no hospital admission required. It's like a daycare procedure where the area is numbed, you'll be completely conscious, and by the end of the procedure, which takes about 3 to 4 hours in most of the procedures time, so there will be a dressing done and you'll be comfortable to go back home. There will be a dressing for 3 to 4 days that you'll have to bear with. Once the dressing is removed, the patient can resume their daily activities. Now, these surgical options for vitiligo are best suited for localized areas or on the exposed areas of the body if the patients are very conscious about it. For larger areas, very large areas, unfortunately, will not have sufficient donor area melanin. So it is limited to areas where it can be completely covered, like exposed areas or patients when they're very conscious about those patches. Even after your surgical procedure, it is important to follow some post-procedure advice that the doctor gives you in the form of topical applications like some creams or phototherapy for a faster induction of pigmentation. Now, so many times parents are worried when we have children with vitiligo. So, doctor, can a child with vitiligo undergo a surgery for vitiligo once it has stabilized? Yes, definitely. It depends if the patient or the child can cooperate with the procedure, or sometimes, like if the parents are quite conscious, we do it also under sedation, where we put the child to sleep with medications and then we perform the surgery. There is no age bar. However, stability is again important, where the child should not have had patches for the last 1 year, and also the child must be cooperative. These are the two important factors that we consider. Sometimes there is a chance that even the surgical option may not be completely successful. There might be some repigmentation and maybe completely not at all. In these scenarios, we have something called a cosmetic camouflage, or we do something called tattooing, where simply a skin colored pigment is introduced through a tattoo machine, and that is as good as the tattooing. So this is also available as a cosmetic camouflage. So with evolving surgical options for treatment of vitiligo, now patients can breathe a sigh of relief. So consult your nearest dermatologist who is trained in vitiligo surgeries to know what is the best treatment option available and how you can benefit from that.